coming up.
Protocols have been put in place to allow so-called safe supply of fentanyl to children under 18 without parental consent or knowledge. Will the minister clearly stand against fentanyl ever being given recreationally to children, yes or no?
Is your government looking to fund the so-called safe supply of cocaine?
A leaked BC Northern Health memo told nurses to stop confiscating weapons from patients and to permit the use of hard drugs in their rooms. Are you aware of this, Minister?
Now on to women's health care. Abortion is health care. Clinic 554 in Fredericton, the last remaining abortion clinic in New Brunswick, closed its doors earlier this year. Can the minister explain why the government failed to save Clinic 554? And can the minister explain what his government is doing to hold provinces accountable when they restrict abortion care? And when will they reestablish abortion care in New Brunswick?
Fair Price Pharma is a company who got 15 kilograms of imported heroin licensed by Health Canada at some point. Has the minister met with the CEO, Perry Kendall?
This Guy's Garage. Like and subscribe.
Pursuant to Standing Order 81-4, the motion to adjourn the House is now deemed to have been withdrawn, and the House will now resolve itself into the Committee of the Whole to study all votes under Department of Health and the main estimates for the fiscal year ending March 31st, 2025. La Chambre est maintenant committee.
The House is now Committee of the Whole for the study of all credits on all votes under Department of Health.
The first round will begin with the official opposition.
Each member will be allocated 15 minutes at a time, which may be used both for debate and for posing questions.
I also wish to indicate that in Committee of the Whole, comments should be addressed to the Chair. I ask for everyone's cooperation in upholding all established standards of decorum, parliamentary language, and behavior. We will now begin tonight's session. Start with the Honourable Member from Fort McMurray, Cold Lake.
Here.
I would like to start out by saying that I will be sharing my time with the member from Cumberland, Colchester, and the member from South Surrey, White Rock. Sorry, it's a bit of a tongue twister. I would like to direct all my questions to the Minister of Mental Health and Addiction. How many people die due to overdose in British Columbia every day on average?
The Honourable Minister has 19 seconds.
The national average since 2016 is 42,000 deaths. The average across the country is 22 deaths per day.
The Honourable Member from Fort McMurray, Cold Lake.
It's 6 that die every day in British Columbia. What is the leading cause of death of British Columbians, youth aged 10 to 18?
The Honourable Minister has 9 seconds.
Current data, it is due to drug overdose.
The Honourable Member from Fort McMurray, Cold Lake.
What is the leading cause of death in British Columbia for those between 10 and 59?
The Honourable Minister has 6 seconds.
86% of overdose deaths have been shown to be as a result of the illicit toxic drug supply.
The Honourable Member from Fort McMurray, Cold Lake.
What is the percentage increase in overdose deaths in Canada after 9 years?
The Honourable Minister has 6 seconds.
Current data shows that 86% of overdose deaths are due to the toxic drug supply.
The Honourable Member from Fort McMurray, Cold Lake.
The answer is 166%. There are around 50 million safe supply hydromorphone pills prescribed in British Columbia every year. How many of those are acceptable to be diverted into the hands of drug dealers who are profiting off the death of Canadians?
The Honourable Minister has 15 seconds.
As the member knows, diversion is illegal in all parts of the country, including all prescribed medications.
Honourable Member from Fort McMurray, Cold Lake.
So is the answer 0?
The Honourable Minister has 3 seconds.
The member knows diversion is illegal.
The Honourable Member from Fort McMurray, Cold Lake.
Is the answer 0?
The Honourable Minister has 3 seconds.
Our CMP has indicated there's been no increase in the data over the past decade.
The Honourable Member from Fort McMurray, Cold Lake.
How much diversion is acceptable to the Minister?
The Honourable Minister.
0. It's illegal.
The Honourable Member from Fort McMurray, Cold Lake.
Has decriminalization been successful in British Columbia?
The Honourable Minister has 4 seconds.
Yes, the number of people who've been arrested rather than being diverted to health services has
The Honourable Member from Fort McMurray Cold Lake.
Then why did you grant British Columbia's request to effectively ban public drug use in most places?
The Honourable Minister has 6 seconds.
We responded to BC's request for an amendment.
The Honourable Member from Fort McMurray Cold Lake.
Why did it take you 11 days to respond to their request?
The Honourable Minister has 4 seconds.
Responsible action.
The Honourable Minister, the Honourable Member from Fort McMurray Cold Lake.
Why not just end it altogether?
The Honourable Minister.
We require a full suite of tools to address the overdose crisis.
The Honourable Member from Fort McMurray Cold Lake.
How are you measuring success in BC's decriminalization?
The Honourable Minister has 6 seconds.
By the decreased number of arrests and referrals to health services.
The Honourable Member from Fort McMurray Cold Lake.
Leading addiction physicians from across Canada have written several letters demanding the minister make all safe supply programs witnessed and recovery focused or shut them down. Will the minister follow the advice from these experts?
The Honourable Minister has 12 seconds.
I met with many experts with many different opinions and advice. We listened to them and took mitigation measures where needed, and we will continue to work to make sure it is safe.
Before the Honourable Member from Fort McMurray Cold Lake continues, I'd just like to let her know that she has 1 minute left on the clock. The Honourable Member.
Protocols have been put in place to allow so-called safe supply of fentanyl to children under 18 without parental consent or knowledge. Will the minister clearly stand against fentanyl ever being given recreationally to children, yes or no?
The Honourable Minister has 13 seconds.
No child has been prescribed fentanyl. Prescribed alternatives are a relationship between a physician and their patient and will be done under strict advisement.
The Honourable Member from Fort McMurray Cold Lake.
Will you stand up against recreational fentanyl to children, yes or no?
Point of order, the Honourable Member from Kingston and the Islands.
The member should be directing her questions through you. She said, will you, asking a question directly of the minister. Perhaps you could just remind the House.
I think you've done it effectively, and I'm certain the Honourable Member didn't mean much by it. So, the Honourable Member from Fort McMurray Cold Lake.
Will the minister stand up against recreational fentanyl to youth, yes or no?
The Honourable Minister has 7 seconds.
Recreational fentanyl is illegal, and we have law enforcement to do that.
The Honourable Member from Fort McMurray Cold Lake.
The minister has the power to say no to this. Will she, yes or no?
The Honourable Minister has 3
Law
seconds.
enforcement places its role in the illegal toxic drug supply.
We will now recognize the Honourable Member from Cumberland Colchester.
Thank you very much, Chair. These questions will be directed to the Minister of Mental Health and Addictions as well. Is your government looking to fund the so-called safe supply of cocaine?
I can imagine what the point of order is, and I'm certain that the Honourable Member from Cumberland Colchester means to ask a question through the Chair. The Honourable Minister has 8 seconds.
All medication is under the CDSSA with strict regulations.
The Honourable Member from Cumberland Colchester.
Is the NDP Liberal government looking at allowing the so-called safe supply of cocaine?
The Honourable Minister has 6 seconds.
Alternatives are under the strict advisement of experts and physicians with their patients.
The Honourable Member from Cumberland Colchester.
Is the NDP Liberal government looking to fund the so-called safe supply of heroin?
The Honourable Minister has 5 seconds.
All medications are regulated under the CDSA, and prescriber models per province are in place.
The Honourable Member from Cumberland Colchester.
Is the NDP Liberal government looking at allowing the so-called safe supply of heroin?
The Honourable Minister has 4 seconds.
Prescribed alternatives are a relationship between the physician and their patient. There are strict regulations around it.
Member from Cumberland Colchester.
Could the minister explain to Canadians what is the company called Fair Price Pharma?
The Honourable Minister has 7 seconds.
It is a private company in British Columbia, to my knowledge.
The Honourable Member from Cumberland Colchester.
Could the minister confirm or deny that this company, Fair Price Pharma, has a dealer's license for heroin?
The Honourable Minister has 6 seconds.
To my knowledge, they do not at this time.
The honourable member from Cumberland Colchester.
Could the minister confirm or deny that Fair Price Pharma has an importation license for heroin?
The honourable minister has 6 seconds.
Eric?
The honourable minister.
Officials to answer that question.
I'd also like to let the honourable members know that when there's time and consultation, that it is not taken away from the time of the member to pose their questions. The honourable member from Cumberland Colchester.
Can the minister tell Canadians how much heroin Fair Price Pharma has imported into Canada?
The honourable minister has 5 seconds.
That is a question to refer to officials.
Honourable member from Cumberland Colchester.
Well, oddly enough, Chair, the answer is 15 kilograms. Can the minister tell Canadians when this 15 kilograms of heroin was imported into Canada?
The honourable minister has 10 seconds.
Again, Mr. Chair, a question for officials.
The honourable member from Cumberland Colchester.
Perhaps the minister would like to tell Canadians that that was in November of 2021. Could the minister tell Canadians, could the minister tell us if the minister has ever met with someone named Perry Kendall?
The honourable minister has 13 seconds.
I have not.
The honourable member from Cumberland Colchester.
Is the minister aware that Perry Kendall is the founder of Fair Price Pharma?
The honourable minister has 4 seconds.
Not engaged with Fair Price Pharma, but to my knowledge, he is.
The honourable member from Cumberland Colchester.
Does the minister believe that heroin should be distributed via vending machines?
The honourable minister has 5 seconds.
No.
The honourable member from Cumberland Colchester.
Does the minister believe that distribution of so-called safe supply via vending machines is indeed safe?
The honourable minister has 6 seconds.
There are strict mitigation rules around prescribed alternatives.
The honourable member from Cumberland Colchester.
Perhaps the minister didn't hear the question, but could the minister tell Canadians if the minister believes that distribution of so-called safe supply via vending machines is indeed safe?
The honourable minister has 10 seconds.
All prescribers are under strict regulatory bodies for medication and treatment to their patients.
The honourable member from Cumberland Colchester has 1 minute left on the clock. The honourable member.
Is this so-called safe supply via vending machines safe, yes or no?
The honourable minister, 5 seconds.
High levels of regulatory risk mitigation are in place for all programs by prescribers.
The honourable member from Cumberland Colchester.
Could the minister tell Canadians, did the MySafe project receive $3.5 million in grants?
The honourable minister has 6 seconds. Stop the clock.
The funding was discontinued to that project.
The honourable member from Cumberland Colchester.
Perhaps the minister could confirm that $3.5 million was indeed given to the MySafe project.
The honourable minister has 5 seconds.
It was funded for several years and then discontinued. The exact number would have to be referred to officials.
The honourable member from Cumberland Colchester.
Could the minister confirm how many former BC health officials have gone on to found a pharmaceutical company aimed at drug dealing?
The honourable minister has 6 seconds.
I have no knowledge of that.
The honourable member.
Does the minister believe that it's appropriate for former public health officials to profit off distribution of drugs and selling to the government they used to work for?
Question, the honourable minister.
I don't deal in hypotheticals, Mr. Chair.
The honourable member from South Surrey White Rock.
Mr. Speaker, my questions will all be for the Minister of Mental Health and Addictions. Does the minister agree that hospitals should be safe places where patient care is a priority?
The honourable minister has 13 seconds.
I think we all agree that hospitals should be a safe place where patients receive care.
The honourable member from South Surrey White Rock.
A BC nurse was told not to breastfeed her child in case her milk was contaminated by drugs she was exposed to at work. As a parent, does the minister find this acceptable?
The honourable minister has 10 seconds.
As a parent, we want all places to be safe.
The honourable member from South Surrey White Rock.
5 nurses on one shift were so sick that they had to be sent to emergency because of exposure to fentanyl smoke. Does the minister find this acceptable?
The honourable minister has 9 seconds.
All hospitals should be safe places for those who work there. We've passed legislation to protect health workers, and provinces have the same responsibilities to regulate hospitals.
The honourable member from South Surrey White Rock.
So would the minister say that should nurses be exposed to fentanyl smoke in the workplace, yes or no?
The honourable minister has 8 seconds.
Legislation to ensure workplace safety, including hospitals, that is regulated both by the province, and we've ensured legislation for health workers to be safe.
The honourable member from South Surrey White.
And yet that didn't happen under this minister in the exemption she granted to British Columbia. Should nurses be exposed to meth smoke in their workplace, yes or no?
The honourable minister has 8 seconds.
As well knows, health services are the purview of the provincial jurisdiction for safety and enforcement.
The honourable member from South Surrey White Rock.
It is, in fact, a combined jurisdiction. Would this minister agree or not agree that nurses should be afraid if they might be stabbed with a knife in their workplace?
The honourable minister has 10 seconds.
I believe all members agree that workplaces, including hospitals, should be safe.
The honourable member from South Surrey White Rock.
A leaked BC Northern Health memo told nurses to stop confiscating weapons from patients and to permit the use of hard drugs in their rooms. Are you aware of this, Minister?
I'm certain that the honourable minister has 12 seconds on the clock.
Hospitals and law enforcement are under provincial jurisdiction to ensure safe workplaces. We, of course, support the enforcement of safe workplaces for health workers.
The honourable member from South Surrey White Rock.
Does the minister then confirm or deny that she granted an exemption to the BC, to the province of BC, at the request of that government, to allow these kind of hard drug uses in public places, including hospitals?
The honourable minister has 18 seconds.
The request by BC for the Section 56.1 exemption had a clear mandate of public safety and public health, and that is how we work collaboratively with the BC government.
The honourable member from South Surrey White Rock.
Well, the minister didn't answer my question. Did this minister, in fact, grant an exemption at the request of the BC government that allowed for hard drug use, unprescribed and unsupervised, in hospitals in British Columbia?
The honourable minister has 15 seconds.
The BC exemption, which was requested by the province, has been amended as per their request to ensure that public safety is a top priority, as well as ensuring public health services.
The honourable member from South Surrey White Rock.
When did the minister sign that exemption?
The honourable minister has 4 seconds.
The member needs to be clear on which amendment.
The honourable member from South Surrey White Rock.
Did the minister sign the exemption that allowed for hard drug use in public spaces, including hospitals in British Columbia?
Before I pass the clock to the honourable minister, I'd just like to inform the honourable member from South Surrey White Rock that she has less than a minute left on the clock. 7 seconds to the minister.
The exemption was signed under my predecessor.
The honourable member from South Surrey White Rock.
Yesterday, I introduced the Safe Hospitals Act that would ban this minister or any succeeding minister from allowing open, unprescribed and unsupervised hard drug use in hospitals. Does the minister agree that this is a common sense?
The honourable minister has 14 seconds on the clock.
The commitment is to work collaboratively with provinces and territories with their jurisdictions and the responsibilities under their purview, which include health services and safety and law enforcement.
Honourable member from South Surrey White Rock has a time for a brief question.
Thank you. Will the minister commit to supporting the Safe Hospitals Act? And if not, why not?
The honourable minister.
Forward to the debate.
Honourable member from New Westminster Burnaby.
First off, the issue of keeping profit out of healthcare. We've seen Conservative premiers across the country trying to take advantage of the healthcare system to allow for-profit corporations to take over. And the minister explained to Canadians what he's doing to stop Canadian Conservative premiers from strangling the healthcare system and allowing profit to take over.
The honourable minister has 27 seconds.
Okay, so in a very short period of time, first thing is the interpretation letters which we need to issue, which I think will be critically important on helping to stem that. Secondly, we recognize that provinces may have taken some actions coming out of COVID to try to reduce burden, but that we need to see those gaps closed and public systems protected. And of course, under the Canada Health Act, we have done reductions in instances where private health care has been present and have the ability to do that in other places.
The honourable member from New Westminster Burnaby.
Now on to women's health care. Abortion is health care, and Liberals promise to expand access to sexual and reproductive health. Abortion care is still inaccessible for far too many, especially in northern and rural communities. Clinic 554 in Fredericton, the last remaining abortion clinic in New Brunswick, closed its doors earlier this year. Can the minister explain why the government failed to save Clinic 554? And can the minister explain what his government is doing to hold provinces accountable when they restrict abortion care? And when will they reestablish abortion care in New Brunswick?
Honourable Minister, 31 seconds.
Thank you, Mr. Speaker. And of course, abortion care is absolutely essential health care, and all women should have access to it, no matter where they are in the country. There are still options in New Brunswick, but not enough of them. This is a conversation I've had with Minister Fitch with respect to the clinic that's been referenced. That's obviously under provincial jurisdiction, but there have been instances where we've withheld because of actions taken on this issue from the Canada from the transfers and the Canada Health Act. But I'd like to be able to fix this again with cooperation. It's essential that women have access to the care that they need. Also, I talk about pharmacare and what we're doing.
Honourable member from New Westminster Burnaby.
If the New Brunswick government is not cooperating, what will the federal government do to reestablish abortion care in New Brunswick?
The honourable minister has 5 seconds.
Well, Minister Hindley's retiring. We have a new health minister. I'm talking to him and the incoming minister on that very matter.
So resuming debate.
Member from Thornhill.
Split my way three ways. The Fair Price Pharma is a company who got 15 kilograms of imported heroin licensed by Health Canada at some point. Has the minister met with the CEO, Perry Kendall?
The honourable minister has 19 seconds.
I have not met with the CEO, but just to be clear, we have not granted a license to Fair Price Pharma. They haven't even applied.
The honourable member from Thornhill.
They are in possession of 15 kilograms of imported heroin as a result of a license that was granted by Health Canada. Just to be clear, has anybody in the minister's office met with Perry Kendall?
The honourable minister has 12 seconds.
I have not met with Perry Kendall, and I will say again, Fair Price Pharma has not applied for a license, nor do they have one.
The honourable member from Thornhill.
In the minister's office met with Perry Kendall, yes or no?
The honourable minister has 4 seconds.
No.
The honourable member from Thornhill.
Has anybody in the office met with representatives from Fair Price Pharma?
The honourable minister has 4 seconds. The honourable member from Thornhill.
Mr. Speaker, the lobby registry says that on September 15th, 2023, that representatives from the minister's office met with Fair Price Pharma. So can she tell the House if that's true or not?
The minister has 17 seconds.
To my knowledge, no one from my office has met with Fair Price Pharma.
The honourable member from Thornhill.
Does the minister have any idea what is going on in her office and who has met with Fair Price Pharma?
The honourable minister has 5 seconds.
To my knowledge, no one on my team has met with Fair Price Pharma.
The honourable member from Thornhill.
This is a order paper question from the government, so either the government is not being forthwith with the House, or the minister has no idea what's going on in her office. Now, has anybody from her ministry met with any representatives from Fair Price Pharma? I don't know how long we're going to have to do this.
The honourable minister has 17 seconds.
To my knowledge, my predecessor, Minister Bennett, met with Fair Price Pharma, but I'm not sure what member of her team they have met with her.
The honourable member from Thornhill.
On September 15th, the minister was actually occupying the office, and the government said that the participation in that meeting was from the minister's office. So was she briefed about that meeting on September 15th, 2023, when she was minister, with the representatives from Fair Price Pharma?
The honourable minister has 18 seconds.
I believe I've answered the question previously, and I will reiterate, to my knowledge, and I know I have not met with Fair Price Pharma. If a member of my team has met with Fair Price Pharma, the member already has the answer.
The honourable member from Thornhill.
If the minister isn't planning to fund the so-called safe supply of heroin, why is anybody in the ministry, her office, her predecessor's office, meeting with Fair Price Pharma?
The honourable minister has 12 seconds.
I have not met with Fair Price Pharma. Our prescribed alternative programs and drugs distributed are paid for and prescribed by the provinces.
The honourable member from Thornhill. And I would like to let her know that she has just over 1 minute.
We are clearly not getting a straight answer from the minister, so I will move on to something that she probably can answer and should answer. She's a minister from Toronto. Her failed experiment in British Columbia that she had to pull back because she was forced to by the radical NDP government there, will she rule it out for good in Toronto forever?
Just say no. The honourable minister has 23 seconds.
Mr. Speaker, the member doesn't seem to appreciate the importance of collaborative work between the federal government and jurisdictions in addressing the overdose crisis. We will continue to work with all jurisdictions as per their requests on what we can do to save lives.
The honourable member has 22 seconds left.
Yes or no question. Yes or no?
The honourable minister has 4 seconds.
The federal government will always work with its provincial and municipal partners to ensure that we address.
The honourable member from Thornhill.
To show that after the next election, if they are elected, they will legalize the same way in British Columbia, in Toronto, that she will do in Toronto that she did in British Columbia. She just basically said yes.
From Thornhill has elapsed her time, but I'll allow the honourable minister to 6 seconds to respond.
We don't work in hypotheticals, we work with facts.
Reprise du débat, l'honorable. Resuming debate. The honourable member for Louis Saint Laurent. My question is for the Minister for Mental Health. The government launched a pilot project a few years ago. Can the minister say which province that was in? The honourable minister has 12 seconds.
Chair, the question wasn't clear. If I could ask the member to repeat it, and I will respect the time.
We will take care of that. L'honorable.
The honourable member for Louis Saint Laurent. Which province asked you for a pilot project for the opioid project? Which province? The honourable minister in 6 seconds.
Knows BC requested an exemption.
The honourable member for Louis Saint Laurent. The answer is British Columbia. Did British Columbia ask you in the past few weeks to review the pilot project conditions? Yes or no? The honourable member has 12 seconds.
From the outset, the pilot program in British Columbia has made a commitment to be monitored, assessed, and be amended as needed. That is why it is a pilot program.
Before the member for Louis Saint Laurent begins, I'd like to remind him that the time it takes for interpretation is not deducted from his 5 minutes. The honourable member for Louis Saint Laurent, thank you very much. Can the minister tell us how much time it took her government to respond to British Columbia's government's request? How many days did it take? The honourable minister.
10.
The honourable member for Louis Saint Laurent. Does the minister know how many people die on average per day in British Columbia due to the crisis? The honourable minister, 5 seconds.
Yes.
The honourable member for Louis Saint Laurent. How many people die per day? The honourable minister.
6.
The honourable member for Louis Saint Laurent. For 10 days, her government waited 10 days before accepting a very legitimate and urgent request from the government of British Columbia. Is the minister aware of the fact that for 10 days, at least 60 people died because this government waited 10 days before saying yes to their very legitimate and urgent request?
20 secondes pour répondre.
The Honourable Minister.
Member is misleading Canadians. People die of overdose deaths due to the illegal toxic drug supply. Decriminalization is simply one tool of many in order to direct people to health services rather than being put through the justice system. I would think that he would not want to stigmatize or criminalize those who need health care.
The Honourable Member for Louis Saint Laurent. 2,546 people died in British Columbia because of the opioid crisis. How many more people need to die for you to act quicker? A reminder to all members to ask questions through the chair. The Honourable Minister. In 9 seconds.
This government has dedicated over $1 billion to this public health crisis, as opposed to the opposition, when in power, cut 2/3 of the paltry $60 million that they put towards saving lives.
The Honourable Member for Louis Saint Laurent. Are Canadians right in worrying that you will extend this pilot project to other provinces? The Honourable Minister, in 9 seconds.
We are committed to saving lives with a comprehensive strategy that considers every tool and resource available, working with jurisdictions.
The Honourable Member for Louis Saint Laurent. After 2,500 deaths, it seems to me that the government should have understood very clearly that the strategy is not working. The Honourable Minister, 6 seconds.
The member doesn't seem to be familiar with international jurisdictions that have also implemented decriminalization tools.
The Honourable Member for Louis Saint Laurent. I am the member for Louis Saint Laurent. I know the province of Quebec very well. Quebecers do not want to see the same tragedy that's ongoing in British Columbia. Can the minister rise and promise that she will never apply this project to Quebec? Yes or no? The Honourable Minister, 12 seconds.
We are committed to working in partnership and collaboration with jurisdictions who wish to address this public health crisis with a robust set of tools, just as we have been committed to using evidence expertise to save lives.
The Honourable Member for Louis Saint Laurent. Well, 2,500 people died because of this pilot project. 6 people are dying per day. What more will it take for you to end the pilot project? The Honourable Minister, 8 seconds.
Every death is a tragedy, Mr. Speaker, but they are dying from an illegal toxic drug supply, not decriminalization, which is a tool that's been used in countries as Germany, Portugal, Spain, Switzerland, and if time allows, I'll continue on the list.
The Honourable Member for Louis Saint Laurent. A quick question, please. Is the Minister familiar with the Benoit Lab Maison House in Montreal? The Honourable Minister.
I am not.
That is all the time. The time has run out.
To the Honourable Member from Bay of Quinte.
Thank you, Mr. Speaker. I'll be directing my questions to the Minister of Mental Health and Addictions. Minister, in Belleville, Ontario and surrounding Bay of Quinte, is there adequate funding and resources for addictions and essential addiction management?
The Honourable Minister in 6 seconds.
As the member knows, health is under the jurisdiction of the province, and they were recently awarded over $700 million towards mental health and substance use in our bilateral agreements.
The Honourable Member from Bay of Quinte.
Minister, aware that in Belleville, Ontario, they reported 240 overdoses in just 11 weeks and 23 overdoses in a single day?
The Honourable Minister has 8 seconds.
I am aware, and as the member knows, I went to Belleville.
The Honourable Member from Bay of Quinte.
Is the Minister aware that Belleville, Ontario had 2 of these epidemic overdoses, not just 1 in February?
The Honourable Minister has 5 seconds.
I am aware, and Health Canada is working with the community.
The Honourable Member from Bay of Quinte.
Is the Minister aware of the opioid mortality rate in the Belleville and Bay of Quinte region?
The Honourable Minister has about 4 seconds.
Federal jurisdiction deals with national data.
The Honourable Member from Bay of Quinte.
Minister know of the opioid mortality rate in Ottawa, Toronto, and North Bay?
The Honourable Minister has 4 seconds.
Ontario is one of the 3 top provinces with high overdose rates.
The Honourable Member from Bay of Quinte.
The opiate mortality rate in Belleville, Ontario is nearly double that of Ottawa, Toronto, and North Bay at 250 deaths per 100,000 people in the first half of 2023, compared to 150,000 per 100,000 people for Ottawa, Toronto, and Hamilton. Does the Minister find that acceptable?
The Honourable Minister has 15 seconds.
As I'm sure every member in this House would agree, no death is acceptable and is tragic and harmful to the families, loved ones, and communities who lose people by overdose due to the toxic drug supply.
The Honourable Member from Bay of Quinte.
Can the Minister state how many bed-based addiction treatment services are in the region?
The Honourable Minister has 5 seconds.
It is under the jurisdiction of the province to implement beds and treatment.
The Honourable Member from Bay of Quinte.
The answer is 0. What's more, the number of opiate poisoning-related ER visits to Belleville General Hospital is more than 3 times higher than the 5-year average. After 9 years, there are no treatment facilities to bring our loved ones home drug-free. What is the government's plan to fund and measure success for the crisis affecting Belleville?
The Honourable Minister has 17 seconds.
As mentioned before, close to over $700 million has been allocated to the province of Ontario to mental health and substance use in the coming years. That being said, in this 2024 budget, the ETF, the Emergency Transfer Fund, offers $150 million over 3 years to communities to seek additional assistance.
The Honourable Member from Bay of Quinte.
Is the Minister aware of the number of Canadians in the Belleville region currently on a wait list, waiting for addictions and concurrent disorder programs?
The Honourable Minister has 6 seconds.
It is under provincial jurisdiction to provide treatment health care.
The Honourable Member from Bay of Quinte.
The answer is over 500 people. Does the Minister think this is acceptable?
The Honourable Minister has 3 seconds.
No.
The Honourable Member from Bay of Quinte.
Can the Minister state what government is responsible for the explosive growth of waiting lists for mental health underfunding for the simple fact that there are 0 treatment beds in the entire Belleville region after 9 years?
The Honourable Minister has 10 seconds.
This is why we signed a $3.1 billion bilateral agreement with Ontario with $700 million allocated to mental health and substance use.
The Honourable Member from Bay of Quinte has 1 minute left on the clock.
Is the Minister aware of the average wait time for residential addiction treatment and supportive recovery programs?
The Honourable Minister has 5 seconds.
They vary jurisdiction to jurisdiction.
The Honourable Member from Bay of Quinte.
The answer is 75 days and 175 days, respectively. On what date will Belleville get treatment beds, and what will be the measure of success for programs to aid in recovery?
The Honourable Minister has 8 seconds.
That's an excellent question to the Minister of Mental Health and Addictions of Ontario.
The Honourable Member from Bay of Quinte.
And Mr. Speaker, why do we have a federal minister for mental health and addictions if they are not working with the province in providing a date to this House to when we're going to get treatment programs for this city? That's under crisis.
The Honourable Minister has 11 seconds.
For an opposition member who says we should get out of the way of the provinces, I'm surprised that he doesn't appreciate that healthcare is a jurisdictional purview of the province and we should conduct.
And this brings to the end the round of questioning here.